Ask unanimous consent that the next hour be equally divided between the following three senators: Franken, that would be me, Lincoln, and Levin.
Without objection.
Madam President, I rise today to express my strong support for the Patient Protection and Affordable Care Act. I commend Leader Reid, Chairman Harkin, Chairman Baucus, and Senator Dodd for their leadership that has brought us to this critical point. We are on the verge of passing legislation that will do more than any bill in recent history to make our country healthier, our economy more stable, and our working families more secure. Make no mistake, this bill will change. There will be amendments to it that will make it an even better bill. And there may be amendments that make it less to my liking, and therefore a less good bill, to my point of view. But the final bill will make health care available to tens of millions of more Americans. It will make health insurance more secure for all Americans who have it, and will put an end to the unsustainable trajectory that we're now on with the cost of health care, and will avert an otherwise inevitable catastrophe to our health care system and our economy. The reality right now is that we are denying millions of Americans their shot at the American dream because of our irrational health insurance system. Right now, if you've been sick, insurance companies can refuse to cover you or charge you ridiculous premiums. And if you get sick, your insurance benefits can run out just when you need them the most. Right now, people without insurance don't get preventive care. Instead, they go to the emergency room when they can't hold out any longer. This is the least efficient and most expensive way to deliver care. And those of us who do have insurance pay for it. It costs every insured family more than $1,100 a year in additional premiums to pay for those who don't have health insurance. And right now, if you're a woman who has had a C-section, or if you've been a survivor of domestic violence, health insurance companies can arbitrarily decide not to cover you. That's because having had a C-section or being the survivor of domestic violence is considered by many insurance companies to be a pre-existing condition. That's just wrong. What's even more egregious is that while millions of Americans struggle to pay for health care, insurance executives continue to make obscene salaries. From 2000 to 2007, period of 8 years, Americans saw their premiums almost double. During that same time, we saw more than 6 million more Americans become uninsured, and during that same time, insurance company profits rose 428%. 428%. That's all you need to know. That's all you need to know to understand why we have to pass this bill. 428% in 8 years. No wonder the insurance companies are fighting this bill. Of course they don't want to be subject to antitrust laws. They're making outrageous profits by gouging American families. Make no mistake, that's what this is about. This bill will change all of that. It will fundamentally transform how health insurance works in this country. This bill guarantees secure coverage that will be there for Americans and stay there when they need it the most. This isn't going to help just individual Americans, it's going to help small businesses too. And there are urgently needed changes that will go into effect the day the President signed this bill into law. effective immediately. Preventive services like colonoscopies and cholesterol tests will be covered by all insurance plans at no cost. This will make prevention a priority, not an afterthought. We will detect cancers earlier and stop chronic diseases like diabetes in its tracks. Not only will this save innumerable lives, it will lower the long-term cost of health care for all of us. This is one of the key ways that health reform transforms our system of sick care into a true health care system. Effective immediately, any new health insurance plan will let your children remain on the family policy until they're 26. That's big. Say you're a parent whose kid has been ill in the past. Maybe she had asthma, and she's just graduated from, the University of Minnesota. Your daughter is just out of school, and she wants to find a job. We all know that this is a big enough challenge in this economy. While she plans for her future, the last thing she should have to worry about is how she's going to get health insurance. The good news is that after health reform, she'll have secure coverage until she gets on her feet. She can either stay on your plan until she's 26, or once the exchange is up and running, she can purchase an affordable plan through the exchange. Also effective immediately, we will hold health insurance companies accountable by making them give rebates if they spend more than 20% of premiums toward profits, marketing, or administration. I'm proud to have championed this safeguard with my colleagues Senator Rockefeller and Senator Whitehouse. Now, the current reality is that most of us don't know where our health insurance premiums go. It's challenging enough to understand a billing statement from your health insurer, much less track where your money is being spent. Well, we're going to change that. Thanks to Senator Jack Reed, the Senate bill also requires transparent reporting of how health insurance companies are spending your money. This transparency is especially important as we cover an additional 31 million Americans under this bill. We know from their profit margins that right now insurance companies are price gouging. But clear reporting will help us hold them accountable for every dollar we invest in health insurance. Based on our experience in Minnesota, I know that we can do even more to rein in marketing, wasteful administrative costs, and profits in health insurance. In the coming weeks, we'll debate this bill, amend it, and make it even better, and I'll be pushing to require that an even higher percentage of your premiums go toward actual health care. The reason I believe that we can provide higher quality care without excessive profits is because Minnesota already does it. We are distinguished by the fact that 90% of Minnesotans are served by a nonprofit health plan. These plans outperform their national peers and are able to put an average of 91 cents of every premium dollar toward actual health care services. 91 cents out of every dollar. In other plans throughout the nation, you may find less than 60% of your premium is put toward health care. The rest is for overhead, marketing, and profits. By taking the profits out of the health insurance industry, not taking them out, lowering them to a reasonable level, Minnesota health plans do a better job of helping our residents live healthier, longer lives. As we begin debating this bill on the Senate floor, it's essential that health insurance companies get the message loud and clear that their top priority must be serving patients, not creating more and more profits. Not 428% increase in profits in 8 years.